The market is freaking out about RFK Jr.'s crusade on healthcare, but smart investors have a great opportunity to quietly position themselves for things that'll outperform. Look, RFK Jr. has made big pharma his number one enemy. It's his personal punching bag, and Wall Street and retail is just dumping everything in the healthcare space. They're selling stocks quicker than you fumble your bags in a crypto bear market. While everybody's running for the hills, they're overreacting and missing these opportunity sectors and things that he actually champions and this administration at large is likely to push forward. His policies could create great opportunities in medical supply chain, biotech manufacturing, medtech, and even alternative medicines. We're talking about a potential reshaping of the entire US healthcare system, which represents one of the largest gold mines and monetary shifts that'll happen in your lifetime. Let's take a dive in and look at what people might be getting wrong about overreacting and selling off medical stocks. So let's get one thing straight. RFK Jr. is not a fan of big pharma. He's against a lot of vaccines. He pushes back on a lot of medications. Fine. Not policy I agree with, but policy that is focused. Because on the other side, he's also pro psychedelics, pro peptides, pro stem cell research, pro American medical manufacturing, and bringing more FDA approved drugs to market quicker. This creates an interesting dichotomy where we have to not bid a sector, but really carefully look at winners and losers under a new policy regime. One of the biggest things to consider here is the new Biosecure Act, which has been introduced in Congress and is likely to get RFK's endorsement and, under the Trump administration, be approved. Basically, as it stands right now, a lot of American pharmaceutical companies get their components and do a lot of their preclinical trial work overseas, with more than two-thirds of that being in China. This new Biosecure bill would be a requirement that any of these companies who want to get federal grants, get federal funding, or do any type of business with any wing of the US government cannot outsource that to China. This would mean a major re-onshoring of the entire medical supply chain and the clinical testing supply chain that would be huge for American business. For example, take a company like Alpha Technova. If you were to build a house, you would need steel and concrete and bricks, and those would be the core building blocks that builders actually use to create the house. But someone else made those components. Alpha Technova is like the same thing for biotech. Alpha Technova is making those building blocks, those precursor components that is needed in biotech manufacturing. They're one of the most likely places that American buying will shift to. Then we have the testing side. As a lot of these companies have to re-onshore, they'll need new lab certification, new certification of their medications, of their precursors, of all these different components. And the longer it takes them to get that, the longer they're unable to bring those products to shelf in America. So they're going to be paying top dollar, and there's going to be a massive demand for US-based testing. And that's where Charles River Labs comes in. You can think of them as the Amazon of pharmaceutical testing. They have all of these diverse tests at different stages of the process that American biomanufacturers and pharma manufacturers are going to need in order to safely bring their products to the US market. There's probably about 8 or 9 other companies kind of in that supply chain space in America that exist right now that are publicly traded and could boom here as well. But then we shift to another sector we call medtech. If we're thinking about RFK Jr.'s war on pharma, then these are Switzerland. They're hard to get mad at. They supply technology and tools that are used in diagnostics around medication and administration around medication. For example, Dexcom with their continuous blood glucose monitor is a great example. You can't get mad at someone for monitoring their blood glucose. There's not a bone to pick there. Or Talkspace, which is mental health, psychiatric, and counseling services via phone and online. There's zero pills involved. There's no vaccines. These aren't pharma products. These are med tech products. And they're suffering from the same sell-off. And I think a little bit of this scare is, are insurance companies going to provide in the same way? Will we still get the same coverage of access? Will Medicare and Medicaid still have the same coverage of access? Maybe not, but these kinds of services aren't likely to be impacted by those shifts. And then while talking about insurance, there's a lot of different varieties and tiers of insurance when we talk about it in the US. We have to consider that some companies are going to have a higher level of exposure to government grants and kickbacks, Medicare, Medicaid, and other types of coverage, while some insurance providers are more high-end private exposure that aren't going to have that same level. I think off the top of my head, one of the publicly traded ones that has that better blend is going to be Humana or something like that. So if we're looking at that insurance opportunity, there's probably specific ones that we can pick out based on who their coverage is, who that demographic is that they serve, that are going to outperform in this market. So I get it. Trying to invest in healthcare after we've had a booming healthcare market over the past 5 years. We've had some major breakthroughs, and now we're seeing a major policy shift. That can be scary. And I get why people are over dumping this market. But there are definitely these granules in there, these diamonds in the rough that represent great opportunity under a new administration. And that doesn't even begin to get into emergent sectors like peptides and psychedelics, which honestly, they're so new. I haven't really digested who are we going to see as winners and losers in the psychedelics space. That's something that still needs to play out. But there's even these second order effects that we can talk about and begin to look at, where now we have this highly visible individual at a regulator position who's pushing for healthy eating and working out and healthy lifestyles. And so maybe we see shifts in health food in America. Maybe your Whole Foods and your organic grocers do better. Maybe we see a shift in gym memberships or supplements as an industry. These are things that we'll have to watch play out. That's usually where you find these best opportunities when you get a bulk sector sell off where everybody is treating every company and every stock as the same, because there's always going to be a quality difference and a focus difference. You can't digest all investments and distill them down. There will always be those diamonds in the rough, and that's where your best outsized returns can come from as an investor. So drop a comment below if there's any companies you want me to dig into deeper, if there's any gems that you think are emerging in the healthcare space that are worth looking at. If you know a bunch about publicly traded psychedelic companies and you think there's ones we should look at, drop that in the comments below. If you found this useful, this quick bite, like and subscribe, and be sure to turn on alerts and get more market news and investment discussions as they happen.